Hi, I'm Josh. I'm the registered nurse with Joy Wellness Partners, and I'm going to be going over subcutaneous and intramuscular injections. This is done for our clients that are sent home to do self-injections. We have our supplies here. First thing we have is our medication. We're going to be using NAD to go over how to reconstitute your medication. 3 milliliter syringe. A 1 milliliter, so we can go over how to do medications that are like 0.2 or 0.5. This is an insulin syringe that comes in the measurement of units, not milliliters. Sometimes they're sent these and it won't call for like 1 milliliter, but it'll say 10 units. Then we have our bigger syringe for the reconstitution of our medication, and alcohol swabs. With these syringes, just to kind of give you a breakdown of these, the black plunger on top here, there's 2 rings. You go off of the top ring for your measurements. So if you wanted to draw up 1 ml, you'd bring this down to that black ring is sitting right at the 1 ml marker. After you've gathered your supplies and before you get started, you want to make sure that you wash your hands. You want to keep everything as clean as possible because you are puncturing your skin. Very, very small risk of infection, but just to minimize that, make sure you wash your hands. Then you'll get your medication. And again, this one needs to be reconstituted. You can tell because the instructions will tell you to, but also everything in here is all powder form. Then they'll send you a vial of bacteriostatic water, and this is what you're going to use to mix your medication. So you'll grab your alcohol swab and you'll clean the top of both vials. You'll let those dry. You'll grab your syringe with your needle. You'll take a look at your vial, and it'll tell you how much the vial is. This is a 10 ml vial. So you'll draw your syringe back to the 10. With the medication on the table, you'll insert the needle into the vial, push in the air, and this will help draw the medication or the water out of the vial. And we'll pull it all the way out. And then you want to make sure all the air is out of your syringe. Take your medication and insert the needle into the vial. And then you'll slowly want to push the water into your vial. Once you have all the water into your vial, go ahead and remove the syringe. You'll want to recap the needle. And once you're completely done with the needle, you'll want to dispose of this in a sharps container. With your medication, you do not shake these up when you're reconstituting. Put it between your hands and give it a nice gentle roll back and forth until it's mixed, or place it in the palm of your hand and you can swirl it. Do not shake this medication. And then when it's all done, you'll see that there is no more powder and that everything is liquid. For this demonstration, I will be using the 1 ml syringe. Remove your needle cap. Draw back the plunger to your dose. We'll say, for this, we'll say 0.3. Insert the needle into your vial. Push that air in. Tilt it up. And then draw back on the plunger. until you get to the 0.3. You'll notice you might have some air. All you have to do is kind of just push it back up, and the air will go back into the vial, and you can pull back down. Another thing you can do is you can hold both the vial and the syringe and give it a little tap. That air bubble will then release up to the top. Once you're at 0.3, you can then pull from the syringe, not the plunger, pull the needle out of the vial. At this point, if you do still see some air, again, just give it a light little flick. That'll release the air, and then you can push the air out until you get a nice little bubble there at the top. You don't want to do the full push and squirt the medication out, because then you're just wasting your medication. That's all you need to see right there to know that there's no air in your syringe and in your needle. For the purposes of this demonstration, I'm going to recap my needle. So I'm not going to be injecting the NAD, because that's not how this medication is given. So I'll be using it with the cap on to demonstrate how you actually do the injections. First one we're going to go over is a subcutaneous injection. There's a few different sites that you can do these injections in. You can use your abdomen. You want to stay about 1 inch all the way around from the belly button. You can use the back of the arm in the deltoid area. Back of the arm is preferred. Or you can use the top of your thigh. Mostly the abdomen and the back of the arm is what's used. When you give this medication, if you have someone there to help you and they're giving the injection for you, what they will do is they'll find the area, take an alcohol swab, you'll clean the area, you'll pinch up a layer, because this is sub-Q, you want it in the fat, so you want to get pinch up the skin so you can get some fat in there. And then when it's pinched, you can go straight in at 90 degrees, insert the needle, and then push the plunger all the way down. When you insert, you want to make it like a quick and smooth motion as it goes in. Insert the plunger in a quick, smooth motion out. And then take the alcohol swab, clean that area again. If you notice any leftover bleeding, you can put a Band-Aid over the spot. If you're by yourself, and let's say you want to do the back of the arm, kind of hard to do the back of your arm and pinch it. So what you can do is, instead of going in at a 90 degree, you go into the skin at a 45 degree angle and go in. That will put it into the subcutaneous, the fat layer of the skin, and you can inject it that way as well. So you can use the deltoid region, you can use the upper thigh, not use that much because it's most uncomfortable, or you can use the glute area, which I will demonstrate on the proper location. Easiest way to find it, you'll find the top of the crack and you'll make an invisible line straight across. And then about mid-cheek, you'll make another invisible line, and you want to be in this area here. And that's where you'll do your injection straight into there at a 90 degree angle. The biggest difference between a sub-Q and a intramuscular injection for you giving it to yourself is you do not need to pinch, but rather you want to kind of tighten the skin to make sure when you go in that you get into the muscle. It's really only helpful if you have someone else doing it for you. If you're doing it alone, it's not a big deal. You can still give yourself an injection into the correct muscle area. Intramuscular, whether you're giving it yourself or someone else is giving it to you, is always done at a 90 degree angle, quick and smooth, straight in, quick and smooth, out. Now when you do this, it can kind of be a little painful. Just kind of rub the area gently for about 30 to 60 seconds, and that'll help kind of spread out the medication so that it's not so sore or tender in that location. Once you're done, again, you want to make sure that you dispose of all of your supplies correctly. Any needle is a sharp, needs to go into a sharp container. Everything else, the regular syringes, empty vials of medication, can be thrown in the trash. I hope this video was helpful and that it was a good teaching for you on how to do injections for yourself at home. But if you do have any questions, please reach out to us at Joy Wellness Partners and we'll be more than happy to help you.